Hi everyone, my name is Joyce. Today I will be showing you how to reconstitute powder medication into liquid and then how to administer it. First, I'll look at the provider's order. The provider has given an order to administer 375 milligrams ceftriaxone IV push over 6 minutes. The patient has a PICC line in the right upper extremity, so I will reconstitute 4.8 ml diluent. So I need to verify the medication with the provider's order. I'm verifying the medication with the provider's order, and then I need to verify the diluent. So I'll assume the two vials that I have, one is powder and another one will be the diluent that we are going to use. So I'll verify the diluent, whether it is appropriate for the medication to be mixed. Okay, then I'll go ahead and check the expiry date of both the powder and the diluent. I think they're all okay. And then I'll go ahead and prepare my supplies that I need. Okay, so I need alcohol wipes. I need gloves. I need 2 syringes. One of the syringes has to be larger to be able to hold the diluent volume. And then I need needles. I'm gonna use these are filtered needles. And then I'll go ahead and wash my hands and I'll do my gloves. I'll first pop one of the vial. I'll pop the lid off. It's already open, but I'll pretend that I'm popping the lid off. And then I'll get the alcohol wipe. And then I'll swap the top of the diluent bottle. This is going to be the diluent that we are going to use with the alcohol swipe. I'll put this in the trash. Put it there for the meantime. And then I'll get my filter needle. I'll open it. With my needle. I'm gonna attach the filter needle on the syringe. And I'll go ahead to I'll get a volume of air that is equivalent to the diluent that we are going to mix with. So the volume of air is going to be 4.8 milliliters ml per the label, what the label says. So So I'll get 4.8 ml of air, and then I'll go ahead and pierce. I'll go ahead and pierce in the diluent bottle the air that I have collected, the volume of air. So keeping the needle in place the way it is here, I'll turn the bottle upside down. Then I'll pull the tip of the needle. I'll pull the tip of the needle just above the topper, so I can be able to gently withdraw the correct amount of diluent that we need to mix. So I'm going to now withdraw 4.8 amount of diluent. Okay, so I'm done with drawing out this. I'll cover, for now I'm going to cover the needle, the filtered needle for now, so I can clean my other vial. So I'm going to pop the lid for the powder vial, and then I'll continue to swipe the vial with alcohol wipe. So with the amount that I have withdrawn the diluent, I'll go ahead and carefully insert the filter needle into the bottle that has powder. So I'm gonna insert the diluent into the powder, but being so careful not to cause any bubbles. So keeping the needle above the surface of the medication, I'll go ahead and then withdraw an equal amount of air that is equivalent to the diluent that we have injected in. So that is it. Then I'll go ahead, I'm going to remove the needle, the filtered needle, and then I'll discard it into the sharps container. I'll discard this into the sharps container. I'll pretend I put it in the sharps container. I only have one needle, so I'll use it to inject to remove medication from the one that we have mixed with the diluent. So my needle here. So with this mixture that I have made of medication, I'll gently mix. To be able to combine the medication and the diluent. I guess it's all mixed up. And then using a fresh needle, different from the one that we have used, the previous one. This is a fresh one. And then I'll attach my filter needle. Go ahead and attach my filter needle. So I can be able to withdraw an amount of medication that was ordered. In this case, we are going to withdraw now 3.8 milliliters of medication. I'll withdraw 3.8 ml of medication. So I've withdrawn 3.8. Then I'll go ahead and discard the filter needle that I've used to withdraw the medication into the sharps container. I'll put this into the sharps container, and then I'll keep the medication into the syringe to take the medication to the bedside of the patient. Then I'll go ahead and remove my gloves. I'll wash my hands once again. I'll don new gloves, and then I'll walk into the patient's room. I'll introduce myself to the patient. I'll introduce myself to the patient and create privacy. And then I'll go ahead and follow the 5 rights of medication administration. I'll see if I have the right patient, I have the right medication that I've just prepared, and then I have the right dose. I have the right route. We are going to use an IV, and the patient has a PICC line. And then if it is the right time to give the medication, I'll explain my procedure, the procedure to the patient, that I'm going to administer the medication through the PICC line that he or she has on the right upper extremity. And then I'll go ahead and flush the IV and then administer the medication. The medication has to be given by the person who prepares it. Then I'll go ahead and I remove my gloves. I wash my hands once again. I give the patient the call light. I make sure it is within reach. I lower the bed. I apply breaks, and then I think that's the end of my scale video. Thank you.